Joining us now, Dr. Ashish Jha, the Dean, of course, of the Brown University School of Public Health. Dr. Jha, well, the sort of good news, bad news, we've got the trend down in the pandemic. The plateau is finally trending downward again, but concern about variants. And now you see these states like Texas opening to 100% restaurant capacity. What concerns you about that?
Yes, Andrea, thanks for having me on. This is just the wrong time to do it. And I think we heard that in that last report. There are a couple of things that really worry me right now. A lot of high-risk people, like Jose's grandmother from the previous report, a lot of high-risk people are not yet vaccinated. And until they are vaccinated, I think we absolutely need to make sure that we keep public health measures in place. And then, you know, this B117, the variant from the UK, is still out there. It's growing in numbers. And I'm happy to see the overall infection numbers coming down. But we're probably a couple of weeks away from that infection, that virus becoming dominant in the United States. Again, wrong time to open up right now. We really do need a few more weeks, 4-6 weeks at the most, in terms of really rigorous public health measures until we're in a better shape.
And today, President Biden is going to announce a new deal securing an additional 100 million J&J doses. That will ensure the U.S. is going to have more than enough vaccine for every adult. So where does this position the country in this race to herd immunity against those concerning variants?
Yeah, so I think there are two things here. One is there's a short-term race, really the next 4 to 6 weeks, as I mentioned, where we've got to get as many high-risk people vaccinated as quickly as possible. I think we'll have the vaccines. I love the idea of more J&J vaccines. The issue will be we will be probably at some point in May, June at the latest, at a point where we have more than enough vaccines for every American adult and more vaccines coming. And the question is, what are we going to do about it? And my hope is that we start being able to share those vaccines with a global community, because there are a lot of people, high-risk people around the world who have not yet started getting vaccinated. So I'd like for us to be able to get these vaccines out to more people around the world as well.
I was wondering about that because that is a high priority among all the foreign policy people I talk to. But there still is resistance and lack of access problems here. And so you've got communities that aren't, on broadband, haven't been able to sign up. The distribution is very disparate in different states, a lack of equity, profound lack of equity in a number of state locations. So how do you begin to distribute quote, excess vaccines around the world if you have not properly vaccinated all Americans?
Yeah, no, absolutely. And I think right now where we are, we still have a supply problem. Demand is still outpacing supply. The issues of equity in my mind are really different in the sense that they're not a supply problem. We have not done a good enough job of placing vaccination sites in these communities. We have not made it easy for people to sign up. Those are things we're going to have to continue working on for weeks and months. But I do think at some point, Andrea, as I said, probably May, maybe June, we will have plenty of vaccines, and that will no longer be a constraint for us. And at that moment, I'd like us to shift to a more global stance and really start pushing these vaccines out, keeping enough for every adult in America, surely.
And top health officials have indicated that more additional CDC recommendations for vaccinated people are coming soon. Do you think that this will loosen up travel restrictions? Because some people say they were too conservative regarding travel.
Yeah, I do. Again, I don't know. I don't have any inside track on what the CDC is going to say, but I do expect travel to be the recommendations to get loosened up, because I think for people who are fully vaccinated, travel is reasonably safe to do, especially if we continue to measure, kind of keep the mitigation measures like mask wearing and all of that that's so important. So I expect new guidance from the CDC relatively soon, and I expect it to head in that direction.
Dr. Ashish Jha, as always, thank you so much. Thank you.
Thank you.
Thank you.
Thank you very much.
Thank all of you out there.
Thank you as always.
Thanks to at home.
Thanks for watching. Thank you so much for letting us into your homes during these extraordinary times.